seat up at the table there. And your blood pressure looks good today.
Yeah, it does. Yeah, I'm really surprised. It's been a hectic few days.
And your sugar.
Most people that have healthcare needs have to go either into Augusta or Thompson, which takes about a full day out of their work day if they need to get any care. And this community of about 600 people has a very low income.
A group of nursing students did a study of this community of Deering to see about the medical needs and discovered there were a high number of uninsured people.
Our first vision was to start a clinic in the school and take care of the students and their parents.
But it helped at the school having specific people that we knew needed medical care or needed assistance in some way, so they were most gracious to help us with that at no cost.
And the school board was resistant to that. So the principal was a member of the Deering Baptist Church. And he said, let's go talk to my church and see if we can start the clinic with them. And so we went over and talked to them, and they were very receptive. And so we started the clinic in their basement. We had one member from the Deering Baptist Church and 2 members from Our Savior in Martinez.
And they would do blood pressure checks and things like that, and then it's grown to where it is now, where they're doing a multitude of things.
They had this house that is a 100-year-old house that had been donated to the church, and they told us if we could fix it up, we could use the house. So I was working with some medical students and nursing students, and we had a work day and got tin donated for the roof and re-roofed the house and put new flooring in. One of the students brought her sewing machine and they made curtains, and we painted and had really a great time putting this house together. Slowly we have built up a base of almost 1,000 patients that we see on a regular basis.
We usually see about 20 to 25 every week. And the average age, I would say on most of our people in their 50s, early 60s.
We reach beyond the city limits of Deering to full McDuffie County, some Warren, some Columbia County, some even as far away as Burke County.
This is a medical facility where they can get help and not be embarrassed that they can't pay.
With the clinic here and the volunteers who live in the community, they don't feel threatened if somebody they see here at the clinic. They also know when the community comes to their house to check on them, they're not threatened at all. It's just they welcome it. You know, it's not somebody from Augusta or somebody. It's just a neighbor coming to check on them.
And I think the people are getting support from each other, which is so rewarding to me. You know, I think sometimes we get people that come in and they're embarrassed about needing help. We give help to anybody, whether they have insurance or not. People have found this is a common place where they can get their healthcare questions answered and a lot of times get their health needs met.
I think it's a huge, important part for the people with diabetes and hypertension. I mean, that's not saying it's not important to other people also, but that would be the majority of what we treat here is diabetes and high blood pressure. And these people, number one, can't afford their medication and probably wouldn't have access to it.
I came into this ministry because the deacon of our church, Sandy, who is the nurse practitioner here, needed volunteers, and I volunteered. And I have thoroughly enjoyed the help that you give to people who don't otherwise have any. Some of them with absolutely no medical care, and I'm familiar with that because I didn't have any for many, many years. So I think this is a blessing for this community.
And before I got on Medicare, I had a period of time without any insurance, and it was a very uncomfortable feeling knowing the situation. And so when I got involved here, I felt like I was doing a service for those that were in that kind of position. Because so many people has no money to go to a doctor, and if they could get to the doctor, they don't have money to get a prescription filled, and what are they going to do? They're suffering. People in that position suffer, and giving them a little bit of help and getting them through when they're having problems, it definitely is a help, and people appreciate it also.
So I feel like by giving a little time and a little patience with patients who are stressed out and feel like they are at the end of their rope, I can help them move a little further in their daily lives.
I appreciate Sandy. I mean, she has plugged into this thing and just poured her heart and soul into it, and without Sandy, this would not exist. I'll go ahead and tell you that.
I think one of the biggest differences it has made is people becoming aware that there is a ministry and a love outside the walls of the church, that people do care about them.
There's no doubt in my mind that the people around here and people who drive from here would not have gotten the care if we had not done this. And with that, it's been a blessing, truly, not just for here, but for everyone who's come here.
I see God in it too, because He has brought together here people of all versions of Christian faith working together to serve the community and serve the Lord. And I think that's in many ways, it's a great picture of heaven. And I just think it's wonderful.